Hi, I'm Catherine Ayers-Wickenhauser, Director of Communications for Direct Trust. Thanks for joining us today with Ann Santifer and Justin Valines from Arkansas Share to tell us a little bit more about how they've used direct secure messaging in their organization and in the state of Arkansas. So Ann and Justin, welcome.
Thank you for having me.
Sure, so can you tell us a little bit about Arkansas Share?
Yeah, Arkansas Share is our statewide health information exchange. We're the only health information exchange that covers the entire state here for Arkansas. And we have the pleasure to be part of the Arkansas Department of Health, which is great because it gives us access to a lot of data that's often siloed in health departments.
Wonderful. And can you tell us a little bit more about how Arkansas Share uses direct secure messaging?
Yeah, we find extreme value in direct trust secure messaging because it's our main avenue for notifying physicians and assisting physicians with tracking their patients. Justin, do you want to tell them a little bit more about the types of reports we send out?
Sure. So we use direct to send out our 24-hour emergency room and inpatient discharges. So they come on a daily report. We use direct. It goes directly to some providers and then to a lot of care coordinators across the state. So they can track their patients when they have a transfer, ED, or inpatient, so they can do that follow-up. We also do the COVID-19 positive report. So any Arkansan that is attributed to a clinic, we notify them that their patient tested positive with a date, so then they can follow up with that patient and their home, the persons in their home, for education purposes. And then finally, we're really excited. This week we kicked off a COVID-19 vaccine report. Since, like Ann said, we're part of the health department. Those reports are really assisting our providers to track when patients get their COVID vaccine dose one, and even dose two, so they can really monitor their patient population and then track those appropriately.
Yeah, and the great thing is providers receive this information without really having to supply us any. So because our health plans are also connected to our HIE, we receive attribution lists from them, and we use those lists to figure out which patient belongs to which physician, which is great for them. So without them having to lift a finger, they get this daily report, or they get these 3 daily reports in their inbox that alerts them on their specific members, which really helps us at the health department too, because the alternative would be a lot of inquiries to the health department. So I'm getting ready to do a vaccine event. Which patient should I be calling in to come and get the vaccine? So they have that information ahead of time, and alleviates the burden of the health department as well.
That's incredible. So it sounds like you all had direct secure messaging in place prior to the pandemic, and then you were able to leverage it when the pandemic started. Can you describe a little bit about that process and how that all occurred?
Well, here at Share, we like to listen to our customers a lot. So, when the pandemic hit, one thing that we thought about right away was, how are these providers going to know that their patients have tested positive? Well, everybody has to report to the health department when somebody tests positive for COVID. It made sense to really, our goal is to foster interoperability and make sure that the data is available to our providers, while reducing the burden on them to go out and seek this information. So it made sense. Hey, we have all this great information here at the health department. The providers need it. How do we get it to them in a secure fashion? And Direct Trust made sense because that's the avenue we were already using for our 24-hour daily reports. We just incorporated that in our workflows. And then when the vaccine happened, same situation. We have providers that want to be involved in that, but they need access to that data. So pushing it to them, we find that it's a more favorable approach. right? So if we're sending data to a provider before they even have the thought of, I need to seek this out, it's beneficial to them, and it really streamlines their workflow. And that's really where Justin comes in. He is a master of workflows. He goes out to our provider practices, he sits with them, he educates them on how to incorporate our reports. Right prior to this call, he was showing somebody how to access their email so they could retrieve those reports and that information.
Yeah, I think it really goes to, whenever you're dealing with, maybe sophisticated systems that health systems are using, they have the education and knowledge. But when you're dealing with rural parts of the state, which we're a very rural state, we have different EMR systems, different workflows, different types of practices in which they see patients. So really us keeping this on the same platform across the state and encouraging the use of Direct and to be able to access that, I think it streamlines us as a health information exchange statewide, but then also allows us to stay on the same playing field. So when they're on calls or they're going or virtual conferences, et cetera, they're all understanding how they're getting the reports, how they're using it in their daily workflow.
That's great. And maybe if we can dig into something you just said, Justin. So obviously Arkansas is a mix of urban and rural areas. So how does Arkansas Share provide the ability for a provider or care team, regardless of location, to get access to the data that you provide?
Sure. So for any of our participants that are connected to Share, we provide them a provider directory and a user directory. So care coordinators, other users within the clinic, we provide that to them. So they can either upload those within their EMR system so they can increase their P2P communication or just referral process. If they can't upload those, we just make it available in a robust spreadsheet for them to be able to access it at any time, so they know where they need to request patient records securely or send a message to request information on a patient. Maybe they refer to the podiatrist or the got a colorectal screening, from a specialist. So it really allows them to be in rural Arkansas, and when they refer to, they call it the big city here in Little Rock, that they're able to still communicate with those providers directly.
Yeah, and all they need is internet, right? So that's all they need to be able to access this data. Though we prefer a fully integrated system with the HIE, we're working seamlessly within their EMR. We also have to recognize that not every provider is at that level of interoperability today. So we try to meet them at their comfort level. And if their comfort level is a web-based application that they log in, maybe they download the patient summary and send it over to their referring partners, that's okay. We want to be able to accommodate our providers wherever they are. Having this, Direct Trust along with our virtual health record in a just web-based application is super beneficial to our providers.
Great. And this all sounds so wonderful, being able to communicate and facilitate communication across the state to share this critical data. And so I'm interested, do you have any data points or any insights that you can share with us about how this has been successful for you all?
Sure. So go ahead.
I was going to say, how do you define success? Is it the number of reports we've been sending out? Because we do that a lot. I think in the month of January, right, Justin, we sent out 18,000 positive COVID results here, secure messaging. So that to me, that's it, because that was 18,000 times that a provider didn't have to call the health department and say, is my patient positive? Or, my patient mentioned that they were positive for COVID. Can you confirm? So I think that's successful. And our reports go out every 9 p.m. because we want to be available to our providers when they get to work the next day. And we recognize some care coordinators get to work quite early. And I've seen that, if we have, upgrades or anything we have to do overnight, that we pause the reports until the morning, our phones start to ring. They're
Yep.
looking for this information, and they're calling and they're texting Justin. Justin, my report's not in my box. What happened to it? So they're definitely using it. They're opening. They're taking action on it, and it's helping the customer satisfaction too, because you feel like now my provider has all the information that they need on me.
Yeah, and to add to that, it's incredible where before maybe we have a new practice come on and they're saying, when we get them set up and work with them on the workflow of how to utilize the HIE and incorporate the reports, when they start to get a report where all patients are on the same report, right, and they don't have to do one by one patients, they're like, where have you guys been? Why have I not used this before? So it's kind of an aha moment because we streamline that, and it really allows them to focus more on patient care if they get it all in one spot than to really just searching, calling, etc. On the phone, which that wastes time, which then that's time that they could be spending and doing direct patient care.
Mm-hmm.
Yeah, so that sounds incredible. I think just the testimony is in and of itself that people are asking for the data, just like you described, Anne, when you have something and you have upgrades that you need to pause and it's not coming in, and they want that. So clearly that's very valuable to them. And I imagine that's why you made the transition into communicating the vaccination results as well. Is that the case?
Yeah, we wanted to make sure that it was a no lift for them, right? Nothing new to learn. So they were already receiving their inpatient discharge or their ER discharge reports, and that one session, we added the positive COVID report to the same location, and now the vaccine report. So they get all three of them in the same spot. It's a single sign-on. So when they log in, they click on the alert on their email and they log right in. And they're ready to go, and they can pull down that information. Mm-hmm. And we can adapt too, because we send out a PDF. Some providers, some larger hospital systems want a little bit more. A PDF is not useful to them, but we can pipe delimited Excel form, and they like that. They can just download that into their EMR and make it part of the patient's record.
That's great. So I think understanding how you all have leveraged direct secure messaging and the Direct Trust Network is really cool to me. And I'm interested if there are any other use cases. So besides the discharge reports, besides leveraging direct for COVID-19 positivity or vaccination reports, how else is Arkansas Share using direct?
Yeah, one use case that we work with at a hospital level, hospitals are dependent upon their designation, they can be penalized for a readmission. So what we do with hospital systems is to create a 30-day readmission report, and that goes directly to their case management, their administrative team at the hospital, because we know readmission had already occurred. But what hospital systems are doing is using those reports to risk stratify their patient population, so that if Justin Valines or Ann Sandifer went and we have congestive heart failure and that is a readmission type, that they're able to track, and if we show back up to the ER and seeing that hospitalist, that then they can already risk stratify that patient. That could be an alert within their EMR system, whether it's Cerner, Meditech, or Epic, just by the data that we provide them over direct. So they're able to then potentially prevent a readmission from occurring. Instead of us getting readmissions for 12 months in a row, we can potentially bring that down. And I know that's a really big concern for a lot of hospitals, especially through the pandemic, because taking money off the top for a readmission, a lot of hospitals are struggling anyway. So this is just another way that we can be able to assist hospitals and health systems and be able to attract their readmissions. And I can tell you, we have worked with many of them. A lot of them use that every day and depend on that to really monitor their readmissions and keep those education points with their hospitalists, with their medical directors of the hospital, and look at what potentially and start looking at maybe in the future what they could expect. So that's one use case for hospital systems. I know with 30-day readmissions is a really key element, and we assist them, whether it's sending them to their HISP that they provide, or us providing the HISP or the direct secure messaging for them to be able to get that. One feature that we also have is that when any report goes out or any of our participants use us in our direct, we notify them in their regular work email. I know a lot of times that, care coordinators, providers, health systems are very busy. They're already checking their one email, their work email. But if we can alert them as well that they have a secure message, that allows them to, have an aha moment. So then they know that they need to go in and see what occurred. And so I think that's really successful because it really continuously puts that and the eye view of the provider or the care coordinator, whoever's receiving those secure messages.
Yeah. I also want to mention our work with our organ donation group here in Arkansas. So a few years ago, their workflow was basically whenever somebody could be potentially an organ donor, they would drive out, try to collect medical records for that person, drive around the state. Little Rock is where folks go to receive really important care, and they drive in from the communities. And so we have these folks driving everywhere trying to collect these records. So we made available to them our virtual health record. But then they use secure messaging to retrieve a lot of that information. So if they see that the person's had an event at a small rural hospital 3 hours from Little Rock, now they don't have to, try to get those records faxed or go and retrieve it in person. They can send out a message and receive that way. It's really streamlined their workflow and really decreased on the amount of time that it takes to make a determination is somebody eligible for an organ donation. And then another one I wanted to touch base on is our work with the foster care kids. So when somebody gets taken into foster care, they have to see a primary care physician for 2 hours. And oftentimes kids get removed from their homes in one county and they're placed with a foster home in a different county to kind of build up some distance between those family members. And one thing we're assisting with is the folks that work with the foster kids can now collect all that information about that child's case and send it over to that primary care physician in that other county ahead of time. So then when the physician is seeing that kiddo for the first time, the foster parents don't have to worry about carrying their records and, being given a manila folder where they have to deliver it to the physician, and he has to sit there quickly and review it before seeing a kid. So it was something that DHS had not a problem, but they wanted to identify a solution, and we were able to help them with. And they are pleased with the way it's working, and the providers are happier too because they're getting that information ahead of time, so they can learn about that patient before that kid comes in for that first visit.
And one other that I would like to add is some of our facilities receive Ryan White funding for testing for HIV. And so they work with multiple facilities. A big one is R-Care. It's a large federally qualified health center that has a lot of testing sites. And they work with multiple entities. And they actually use Share to be able to send the medical records securely on that HIV patient securely. Doing that for years, and that's their method, not only internally to be able to share the medical record of that particular patient when a sensitive lab comes in, such as HIV, but they're able to share it with external providers as well, making sure that gets over and not faxing or mailing the medical record, and it gets there faster, instantly. So they're able to really see what's going on with that patient that's dealing with a new diagnosis or such as HIV.
Well, it sounds like you are leveraging direct in so many ways, and one of the things that just struck me with what you were saying, Justin, just emphasizing the security and how this can be trusted exchange, and it's more secure than fax or email. And how quickly this communication can happen, and especially looking at the situation of a pandemic, sometimes that instant communication really does matter, and that quick turnaround time. So I think one final question for you both would be, is there any encouragement or any advice that you could provide to someone who's looking at using direct secure messaging?
I would say, one thing we really listen to what folks are saying, because anytime, with whether it's with maternal mortality or with the foster kids or anything like that, folks are trying to identify ways to share records, and sometimes they don't even know that this service is available. So we really have to educate folks and talk about it and talk about it and then listen to them. So whenever they say, I'm looking for an avenue to share this information, and we can say, oh, well, here it is. We have this. It's already in place. We already have those connections to those providers, and granting access is so simple. It takes about 10 minutes for somebody to create an account, and now they have the ability to use that service.
Yeah, and I think too, workflow, a lot of practices or hospitals really have been doing something for, years and years. And that 6-letter word, change, is sometimes very hard for, clinics, et cetera, to do. So really walking them through there. We provide training guides, we provide live training virtually, and then hopefully on site, here coming up once everyone gets vaccinated, fingers crossed, right? But that's really key is that workflow and working with them one-on-one to really educate them and show them the right way. And then when I'm working with a clinic, and I always say, they're like, oh my gosh, this is great. I'm like, okay, look at your biggest referral partners and reach out to them, whether it's OBGYN or oncology provider, and then ask them what their direct secure messaging is. And so that you can have those conversations to change your workflow, because they're probably going to expect it coming over fax or, mail it in, and et cetera. So if you change any workflow, always educate yourself, of course, but then also have those conversations with your referral partner so that they know that they can expect things in a different way.
Yeah. And I would just say, lastly, our motto here at Share is axe the facts. And we really think that direct trust secure messaging is that strategy, right? We want folks to stop faxing medical records. That's our goal. And this plays a huge part in it.
Well, Anne and Justin, thank you so much for this time together. It was really great to learn more about what Arkansas Share is doing. And I think you all provide a tremendous model for the many different ways and use cases that direct can be used to get data securely from one point to another. And from the bottom of my heart, thank you both for the work that you do in health IT and the difference that you're making in the lives of not only the patients of Arkansas, but also the providers too. So from Direct Trust, thank you so much. And thanks for being with us today.
Thank you for inviting us. This is great.